Today we did lead a panel discussion that was directed at legislators and their staffs. Dr. Lester Grinspoon, who you saw, who was part of the movie here, he is a doctor of psychiatry from Harvard University, and he came out and joined us as well, as is Scott Mortimer, who's with us tonight, and who is a longtime medical marijuana patient and advocate. And I think it went very well. We had a good showing, and we were able to indicate to legislators and their staffs that this is a serious issue. That's about relieving the suffering of people who are dealing with serious conditions like chronic pain and HIV and cancer.
So what brought you down tonight?
Well, I was interested in the panel about medical marijuana, and I wanted to see whether any disability rights perspective was going to be presented, because I don't really see this as so much of a medical issue, although I can understand why people might want to frame it that way, but a disability rights issue, as in here is something that assists us and empowers us and gives me more and better feelings in my body and releases muscle tension. I should have the right to use that in consultation with my doctor. And as a disabled person, and there are physical conditions that marijuana just helps, and it's been documented anecdotally. And if they wanted to do a survey, they could find the same information.
And what conditions do you have?
Well, I have a spinal cord injury, so I have spasticity. I can just sort of have a jangled feeling in my body, or body anxiety, because I can't jump up and run around and discharge it. So it helps kind of release physical energy. I don't have a lot of feeling below my injury site, and marijuana adds feeling, so it makes me feel better. So pleasure is a right that we all have also.
The minimum amount of medical marijuana necessary in order to address those symptoms. So the last thing they're looking for is the psychological aspects that would make them less effective in their job and in their family. So when they hear stories about how the program in California is maybe a little bit loosely regulated and some recreational users are taking advantage of it, they become very offended and very upset about it. So we are trying to demonstrate that what we're talking about here is establishing a legitimate medical marijuana program that's really based around the needs of patients that are suffering from various diseases. We're at Massachusetts Patient Advocacy Alliance, and you can visit us online at www.masscompassion.org. We've got all kinds of information on there, and there's a contact form as well. If you fill that out, it'll come straight to me, and I'll follow up with you and let you know how you can get more involved in our campaign.
And I recommend everybody who's watching this video, if you can't come out of the closet because of your work or whatever, at least sign a bill or call your representative. These guys have come out of the closet and they're helping us. So even if you think you can't do it, just make a phone call.
Yeah, and that's totally confidential. If you call your rep, or send them an email, that's totally confidential, so you don't have to worry about any kind of repercussions. So we encourage you to do that.
And please do. Well, that's it, and we want to thank you for watching, and thank you again, Matt Allen.
Appreciate it.
This is the King of Pot at BU, KOPproductions.com.